Taseer Zafrani Marwaridi Sperm Grow course. Assalamu viewers, hope you are doing well. Today I will explain you about the course which name is Taseer Zafrani Marwaridi Sperm Grow course offered by Taseer DawaKhana Private Limited. This course is prepared for the male infertility patients to cure the disease. By using this course, patients are covered with male infertility problems in few months. In today's program, I will brief you about what is Taseer Zafrani Marwaridi Sperm Grow course, how it can cure the disease male infertility, why male infertility happens, its symptom, reason of disease, indication, male infertility types, complete detail about the sperm quality and quantity. Viewers, first of all, we should not know what is infertility. The problem causing inability to conceive live with the male partner, it is a term male infertility. More than 7% of females in the sexually active age of group of 45 years age were diagnosed with infertility problems in the world in year 2019. Of disease, 14% were diagnosed with a sperm-related problem and 6% were varicose. Fertility in males are male evaluated by checking sperm count, sperm motility and sperm morphology. These abnormalities result in male infertility. There may be also be nothing wrong with the sperm, but blocking the sperm ducts that are making it possible for the couple to conceive. Factors that cause male infertility. A number of factors may contribute to male infertility. Some of these are listed here. Erectile dysfunction, where the male is unable to get or maintain an erection. Hormonal imbalance, leading to low level of sperm production. Lifestyle problem, like drug abuse, drinking, smoking, addiction can cause sperm production problems. Delayed ejaculation, where the ejaculation occurs really late or doesn't happen at all during sex intercourse. Infection or inflammation causing issues with sperm production. Damage to sperm ducts making transportation of the sperm a problem. Torsion, where the testicle get twisted around the inside the scrotal sac, causing swelling and blockage. Undescended testicle, causing sperm production problems. Varicose or large vein in the genital region. Ejaculatory impotence, where the male can't ejaculate during coitus but can during masturbation. Premature ejaculation, where erection can't be sustained for more than 30 seconds. Anospermia, sperm quality causing inability to conceive. Exposure to radiation can diminish sperm count. Stress and obesity. Retrograde ejaculation, where sperm passes back into the bladder instead of out through the penis orgasm. Pterospermia, abnormal sperm shape causing infertility issues. Oligospermia, sperm count is too low to get a partner pregnant. That there are literally dozens of factors leading a complete normal spermatozoa. The form of sperm that is present in the semen. These involve the sperm structure of the testes, the hormones that influence its function, the receptors for those hormones, the maturation process through which the germ cell develop into a spermatozoa, the composition of the seminal plasma and all the enzyme receptors, and the reaction that make the sperm capable of fertilizing egg. In these steps, there are dozens of occasions for mistakes and problems. Hormones play an important role in the disease male infertility, and there are several hormone levels which can affect on a person for producing a child, like testosterone, LH, follicle-stimulating hormone, FSH level. In hormone is an important topic that affects the function of sex organ, that is released by the pituitary gland in the response to luteinizing hormone. Abbreviated LH. In male, the LH has length and sequence of the female menstrual cycle, including ovulation, preparation of the uterus for inflammation of fertilized egg, preparation of the uterus for implantation of the fertilized egg, the ovarian production of both estrogen and progesterone. In male, LH stimulates the testes to produce estrogen, also known as interstitial cell stimulating hormones. For males, the normal range of luteinizing hormone is 1.5 to 4 till 7.8 international units per liter. If luteinizing hormone level are below the normal range, it may indicate a pituitary gland problem. The pituitary gland problem may not be making enough luteinizing hormone, which may lead to low testosterone. In general, the normal range testosterone level in male is about 270 till 1080 nanograms per deciliter, with an average level of 679 nanograms per deciliter. A normal male testosterone level peaks at about age 20 and then it slowly declines. Testosterone level peaks at about age 20 and then in tolerability range are considered by many to be out of balance, or below the normal range are considered by many to be out of balance. Follicle stimulating hormone FSH level in one of the gonadotropic hormone, the other being luteinizing hormone. Both are released by the pituitary gland in the bloodstream. Follicle stimulating hormone is one of the hormones essential for pubertal development and the function of women's ovaries and men testes. In women, this hormone stimulates the growth of oval follicle in the ovaries before the release of an egg. For one follicle evolution, it also increases estradiol production. Follicle stimulating hormone act on the Sertoli cells of the testes to stimulate some production, spermatogenesis. Normal follicle stimulating hormone level in adult men are typically between 1.5 to 12.4 international units per liter. A high follicle stimulating hormone in male may mean that the testicles are not functioning correctly, while low follicle stimulating hormone level in males may indicate the problem with the pituitary gland in the brain. There are two types of infertility: primary infertility and secondary infertility. Primary is the inability to conceive a child after regular intercourse for at least 1 year, while secondary is the occur in couples who have previously been pregnant at least once but are unable to achieve another pregnancy. As per medical research, in 50 to 60% infertility cases, male have infertility problem. A number of causes exist for male infertility that may result in male impaired sperm count or mobility or impaired ability to fertilize the egg. The most common cause of male infertility includes abnormal sperm count, production of function, impaired sperm delivery, condition related to mental health, a lifestyle and overexposure to certain environment elements. Viewers, semen producing testes. Testicles are very important in sperm production. If testicles are not working correctly, then it makes a problem. There are two types of testicle disease: hydrocele and varicocele. Hydrocele is a type of swelling in the scrotum that occur in the fluid when collected in the thin sheet surrounding the testicle. Hydrocele is the most common in newborn and usually disappear with treatment by age 1. Older boys and adult men can develop a hydrocele due to inflammation originating within the scrotum. And the second one is varicocele. A varicocele is an enlargement of the vein within the loose bag of skin that hold your testicle. A varicocele is similar to a varicose vein you might see in your legs. Varicocele is the most common cause of low sperm production and decrease by sperm quantity, which can cause infertility. Viewers, I will tell you about the sperm disease. There are 3 types of sperm disease, named as azoospermia, oligospermia, necrospermia. First one is azoospermia. It is a medical condition of a man whose semen contains no sperm. It is associated with infertility, but many forms are amenable to medical treatment. Azoospermia's main cause is infection. It includes pus cell in the semen, blood in semen, presence of bacteria. This condition does not have any symptoms. Azoospermia is further divided into 2 more types: obstructive and non-obstructive azoospermia. Obstructive azoospermia is defined as absence of spermatozoa in the ejaculate despite nasal spermatogenesis. Obstructive azoospermia is a common urologic condition and accounts for 6.1% to 13.6% of patients presenting to fertility evaluation. Non-obstructive azoospermia is defined as no sperm in the ejaculate due to failure of spermatogenesis and is the most severe form of male infertility. Second type is oligospermia. This is a male fertility issue characterized by low sperm count. Other aspects of sexual health of a man with this condition are typical. These include the ability to get an erection as well as produce ejaculation at orgasm. Sperm count in your ejaculate can vary throughout your life. As explained, the normal sperm count is between 200 to 600 million, so if a person has less than 120 million sperm count, then he has oligospermia. This disease is because of infection in the vein, physical dysfunction, anxiety, abnormal hormonal level. Now I will tell you about the third fertility disease, that is necrospermia. Necrospermia is a condition in which there is a low percentage of life and very much percentage of infertile spermatozoa and semen. It can be diagnosed by a semen analysis with utility staining performed rather to determine the sperm are dead or alive or immotile. Because of this, men are unable to make a woman pregnant. There are some conditions required for pregnancy. 50 to 60% active sperm motile. Good health is essential for both men and women. Male semen has normal sperm count. If a person is not meeting this given criteria, then he is not able to produce a child or make a woman pregnant. After age 72 hours, men should produce 1.5 to 5 milliliters of semen. When a normal person ejaculates, then he releases 200 to 600 million of sperm. If he has 50 million or less than 50 million active sperms, then he is not able to produce a child. Viewers, a man produces 50,000 sperms in a minute, 72 million in a day. These sperms get mature in 84 days. Infertility may be occur because of different sperm disease. Taseer DawaKhana has been established in 1946 and you can recover from all diseases by using Taseer Zafrani Marwaridi Sperm Grow course by Taseer DawaKhana, which is made with precious herbal ingredients and free any side effect. Doctors and scientists of our institute, Taseer DawaKhana, work under the supervision of Hakim Dr. Taseer, qualified doctors, lady doctors, pharmacists, and Hakim with prolonged research. Taseer Zafrani Marwaridi Sperm Grow course is a chemical-free natural supplement with no side effect. It is prepared from pure herbal ingredients and 100% effective. Taseer Zafrani Marwaridi Sperm Grow course cures azoospermia, oligospermia, necrospermia, varicocele, hydrocele, pus cell, infection, hormonal level, maintain pH level of a person, increase the volume of semen, thickness in semen, sperm morphology, every type of infection, and start producing sperm where a person will live from all repeated ways. Increase HGH level, follicle stimulating hormone, luteinizing hormone, normalize the sperm count of infertile men so they become fertile. Taseer Zafrani Marwaridi Sperm Grow course is prepared under the medical principle and proper scientific method with up-to-date machinery. Taseer Pharma Private Limited. Taseer Zafrani Marwaridi Sperm Grow has some special herbal ingredients. Those qualities achieve the gain of centimeter in penis length and specially give help your confidence and sexual satisfying experience, which is specially prepared for those who have erectile dysfunction, ejaculation, duration problems, stiffness, and length with problems with penis. It is very safe and easy to use and made with 100% pure herbal extracts. During the treatment, you should follow these precautions for better treatment. Don't go for sex during the treatment. Use fish, eggs, butter, milk, honey, dates, lemon, garlic, pumpkin, radish, carrot and dried fruit in your diet. Try to eat meat on daily basis. Abstain from the beef, rice, olive food, potato, bakery foods and junk food. Limit or abstain from alcohol, smoking. Avoid this thing too late. Avoid things that lead to prolonged heat for the testicle. Keep the weight off. Steer clear of the illicit drugs. So viewers, I briefly explained about the male infertility in my video. You know one have this disease, so you can visit our clinic or call us in our office timing, which is 9 AM to 8 PM and discuss your problem. I hope this video was informative for you and helpful. If you like this video, kindly subscribe our YouTube channel and click on the bell icon. I will see you again in our next video in which we will discuss new disease topics and treatment. So viewers, it's time to say goodbye. Have a nice day. Take care. Allah Hafiz.